Today, I'd like to talk about the indications of gastric ESD in the year 2019. Before detailed discussion, I'd like to make the definitions clear. Indications are different from criteria. Indication is something that we consider before the treatment. Criteria is what we consider after the treatment. Decision-making about additional surgery is done by the criteria. Traditionally, there are two types of indications. Absolute indication means differentiated type mucosal cancer without ulcer and not bigger than 2 cm. Expanded indications include differentiated type EGCs bigger than 2 cm and selected cases of undifferentiated type early gastric cancers. B3 lesion, which means minute submucosal invasion for differentiated type histology, is not indicated for both recent Korean and Japanese classifications, but included in the curative resection histology in both countries. This is a real-world statistics. Among 355 early gastric cancers initially treated by ESD, 120 cases, this is 34%, belonged to the beyond absolute indication group. Some of them require surgery. 10% of patients in the absolute indication group were initially treated by surgery. And you can see the reason in the box at the right-hand side corner. Suspicious lymphadenopathy was the most common reason for surgery. In Korea, ESD candidates are usually selected by the absolute indications. After ESD, expanded criteria is applied to determine whether the resection was curative. There are controversies about the safety of ESD for expanded indication cases, especially because Korean studies consistently showed higher risk of lymph node metastasis in expanded indication cases than Japanese data. I'll show you some examples later. Korean practice guideline for gastric cancer was just released. The first statement is about absolute indication. Endoscopic resection is recommended for well or moderately differentiated tubular or papillary early gastric cancers meeting the following endoscopic findings. Endoscopically estimated tumor size 2 or less than 2 cm, endoscopically mucosal cancer, and no ulcer in the tumor. Let's talk about expanded indications. Do you think total gastrectomy was necessary for a 45-year-old lady with 1 cm signal ring cell carcinoma? In my opinion, it was too much. Less invasive options should be considered. What would you recommend for a 40 years old woman with a small, flat signet ring cell carcinoma? I performed the ESD and the final pathology was 10 mm, limited in the lamina propria layer, clear resection margins, and no lymphatic invasion. ESD for expanded indication cases can be selectively performed in the individual cases. Flat, small signet ring cell carcinomas are frequently treated by ESD in Korea. Statement 2 is about expanded indications. They say ESD could be performed, but the recommendation level was week 4. This is the comparison of recent ESD indications in Korea and Japan. Korean indications are either strongly recommended or weakly recommended. 2 of weakly recommended indications in Korea belonged to Japanese absolute indications. So there are some minor differences between two countries, but in overall, almost the same population is treated endoscopically in both countries. Thank you very much.